Hey, what's up you guys? Hey, thank you for checking out this video. I have a little case for you, case study, and so let's get to it. It's a 51-year-old male who is HIV positive, comes in for diarrhea, nausea, and vomiting. Medicine team consults you because you just get a call from the clerk, okay? The clerk goes, patient has, barely understandable, the clerk is, the patient has hernia and abscess. So I said, what does that mean? The clerk doesn't know. Then I proceeded to spend another 20 minutes on the phone trying to get a hold of somebody that had an idea what this meant, and they didn't know either, so I just went to the chart after a while. Actually, I just went to see the patient and said, F it, just go. Anyway, so guy complains of nausea, vomiting, some diarrhea over the last couple days, no real abdominal pain. However, when you talk to him, he does have a history of stab wound in the late 80s into his belly. He's got a laparotomy scar, a pretty big one. It appears that he was at some point left open, his skin and subcutaneous tissue was left open. And he has the apex of the wound has a hernia. It's actually on the right side of the apex of the wound. You can see it's protruding out there. And he's got this horizontal scar over that thing too. So I asked him, what's this all about? He said, oh, I had a hernia repair 2 years ago. No, 2014. So 3 years ago. And it came back. And then he had a little scab at the top of the wound. I said, what's that? He said, oh, this is just by the way, this is totally illegible of what he's saying. You cannot understand what it's like. He's got marbles in his mouth. He speaks complete English, but he can't understand what he's saying. And I said, what is that? And he said, this is, I think what he said was, this is fluid comes out of this little scab every once in a while. And I said, when does that happen? How often does that happen? And he said, well, I asked him like 4 times and he gave me 4 different answers basically. He couldn't tell me when it was coming out, how frequent, and what it looked like, and if it's related to anything. He did say that he picked at the scab, and when he picked at it, it seemed to drain. It is right over where his hernia is, and they do have a CAT scan prior to calling me. So I looked at that, and it was obvious that there was small bowel right in the hernia, stuck in the hernia. It didn't appear that it was obstructed or inflamed or anything like that. So my question to you guys is, what are you gonna do with this dude? Oh, by the way, on the CAT scan, it appears he has a renal cell carcinoma. Surprise, motherfuckers! So, what are you gonna do with this guy? You wanna fillet him open? You wanna scoop out that weird draining thing that we're not really sure what it is, or when it drains, or if it drains, or what it looks like? So, you tell me what you guys are going to do, and I will give you a couple weeks and get back to you with what we did. Alright? This is fun shit, isn't it? Alright, talk to you guys later.